My name is Jeff Byers. I'm the owner of Sunback Moon Private Patient Advocacy and Healthcare Solutions. So words that I speak here today are me and my company. The other companies listed there are nonprofits that I'm on the board of directors for, so I'm not speaking on their behalf, just mine. As Brad said, I've been 31 years as an EMT. It actually changes to going on 32, I think, this month. I have a bachelor's degree in accounting. I spent 14 years at Blue Cross Blue Shield of Alabama, 2 years at UAB Medicine, and I am the winner of the 2022 Advocate of the Year Award last year. So before we get started in this, I want to do a quick audience survey. Any healthcare workers in here? Nurses? Physicians, EMS. I know we got one. Oh, we got two. I see another EMS folks back there. PAs. Gotcha. Okay. Like to see that. Anybody in healthcare administration? Okay. A few administration. Any of the foundations represented here? Okay. Independent advocates. There we go. All of us. Raise our hand. That's awesome. So what we're going to talk about today is what we can do for our clients as an independent advocate in the event of an emergency. How do we do a pre-plan? We're going to talk about what the family can do, what you as an advocate can do to help once 911's been called. Things we need to do, things we need to avoid. What happens when EMS gets to your house or the location wherever the incident is at? And what happens when they leave? What happens when they get to the hospital? Spend a little bit of time talking about this. I'm not going to take up a lot of time because I want to do some Q&A afterwards. But I want this to benefit you guys is we're in the business of selling, right? We're selling our knowledge and our service to our clients. We're providing a benefit to them, but we're selling our business and our knowledge to our clients. So I want you guys to leave this with the knowledge to be able to go out with your clients and sell this to them. Let them know, hey, this is some things we can do to make life a little easier, improve things if you end up in an emergent situation. We've all got these clients that we know more than likely they're going to be transported by an ambulance at some point in time. But any of us could be transported at any given time. So I want to prepare you guys to have that information, to be able to offer this service. It may be something your client never uses, but in the event they do, they're going to think back and say, wow, this worked a lot better because we knew how it was going to unfold. So pre-planning before the emergency. What do we need to ask ourselves before they need to call 911? First thing we think, can they find your client? You think that's kind of a no-brainer. It's difficult, honestly. From this side of the fence in EMS, it's very difficult to find people sometimes. This is an actual picture from my vehicle returning back from a call one night. Can y'all read the address on that mailbox? I couldn't either. So I took this one just as a demonstration. We don't think about that when we're driving down the road. We see people's mailboxes, pass dozens, hundreds of those, thousands every week. We never think about it. We don't think about the information that's on there that first responders are going to need. All these different numbers on there. Anybody got a guess as to which one of these is the best number? None of them. Absolutely none. There's problems with all of these. The little gold ones that you see, like the first one there, they're difficult to read at night. You can see them during the day, but they got to be big enough. So issues with all of that. What about here? Same mailbox. Depends on which way you're coming from, whether you'll find them. And trust me, just because the ambulance service is this way doesn't mean that's where they're coming from, okay? They come from every which direction. We do get lost. It happens, okay? So make sure that there are numbers out there. This is stuff you can work with your clients. And I know often we do this remotely, but if you're going to a client's house and you're having trouble finding it in an afternoon, imagine at 2 o'clock in the morning in an emergent situation. Think about that. That's something that we can sell to our clients. So some rules of thumb here. Minimum 3-inch high. This says white reflective numbers on a dark background. Even a dark number on a reflective background will work. Make sure it's on both sides of your mailbox. If all the mailboxes are on one side of the road, have them put a directional arrow if they're across the street. Sometimes you'll see a bank of mailboxes and you're not exactly sure which one. Some areas have odds on one side, evens on the other, but it doesn't always work that way. Also put it on your house. Sometimes it's more difficult to see, especially in some of the rural areas, but if you think of a townhome setting where you've got a lot of different row houses, mailboxes may be at the entrance to this subdivision. Okay, we know we're in the right subdivision, but which house, which door do we go to? So put it above the door, close to the door. And this is one of the cases where bigger is better. All right, so we've got it where they can find our clients, right? We've helped them go through this process to get things set to where they can find them in an emergency. Now, can they get to them when they get there? Anybody ever seen Hoarders? Ryan, you're smiling out there. I know you've lived this one. Imagine trying to get a patient out, your client, that's sitting in that chair back there by that computer monitor. They need to be put on a stretcher and got out of there. Things like this is stuff we can think about. How many of you guys have helped a client that was coming home from the hospital? They were going to be on home health. They were getting a hospital bed, some other medical equipment when they come home they may put the bed in the living room. They may not be in the bedroom anymore. We think about it in those scenarios, but there's people that go home from the hospital every single day that still have issues that they can't get to and from. Help your clients with this. It's going to help them if there's an emergency. It might save a life at some point in time. Next slide I've got here. Let me set this one up. Another thing you can do with this, some of the fire departments, Ryan, I'm not sure if your area does this. Some fire departments will do a home assessment to help you with this. So this may be something as an advocate you can connect your clients with their local fire department to come out and do an assessment. They're going to look for things like, is there a ramp? Is there stairs that are wiggly or broken? Is there carpet that there's no floor underneath in the house? There's things like that that can make it very difficult to get somebody out. A few months ago, I was traveling and saw it's hands down, it's my favorite t-shirt I have ever seen of a fire department for this service. This is an actual firefighter having breakfast at a restaurant we were at. They come in and sit down, trucks out front, and I saw this and just had to stop. Best fire department shirt I've seen, hands down. You're probably not going to see this everywhere. This was on Vancouver Island in Canada, British Columbia. Probably not going to see it everywhere, but there are programs like that with fire departments that will come out, do an assessment, help you figure out ways to improve access, ability to find them, ability to get folks out of a house if need to. We mentioned clear path ramps, weak floors, wobbly steps. Another thing we've got to consider, as a population, we're getting bigger and bigger. How many comes in on an ambulance typically? You got 2 people coming in on an ambulance. You got a patient that's 6'5". They're in an upstairs bedroom. You think they're going to need some help? That's some stuff with the pre-planning we need to have and let that family know if they have to call 911. This is additional information they probably need to let the dispatchers know about. Next up, where to transport. I know if you're in a rural area like I am, there's one hospital in your city, one in our entire county. That still may not be the hospital that your client wants to go to. Depends on what services are there, what their typical hospital is that they go to for treatment. That may be an hour away. They may live in a urban setting and there's 6 hospitals within a relatively same distance. Have them thinking of that mindset of where they want to be transported. It's going to be that patient's decision where they go within certain parameters. So they need to be thinking about that. If they've got that plan in place and they know here's where I want to go, it's going to make things move much more smoothly. With that, we want to make sure that the family, home health, anybody else involved in this patient's care knows about this plan. Okay? Mama, daddy, mother, brother, sister, everybody needs to know about the plan. What do we do? Where are they going? including you as the advocate. It's not going to be our decision. We don't make these decisions, but we need to know about it. The other thing with a choice for a hospital, you need to have a second choice. Ryan, how often you guys go on diversion at different hospitals where you're at? It happens a lot. The general public doesn't realize that oftentimes there's a hospital on diversion and your first choice may not be where you can go. In Alabama, we've actually got a piece of paper that's on the ambulances that they can sign that says, I still want to go to this hospital, but it is notifying that person that they are going there against a diversion and they're not going to be seen as quickly as they would if they go to another facility. So have that in mind. Have a backup plan. So we've got our pre-plan in place. What happens after a call's been made? Okay, our family that we're working with, they call and say, hey, we've called, ambulance is coming to get mama, just wanted to let you know. You can also sell this as a service to pre-plan if you're close enough. Make sure their doors, I skipped ahead on there. Things we need to do while they're getting there. Make sure the doors are unlocked. I'll get to my other thought here in a second. Pets. How big a problem do you think pets are for the EMS crew that's coming in? The little chihuahuas are ferocious, okay? They are ferocious. Terry will tell you about it. She's been in home health. She knows how it is. My best story for a chihuahua was a patient that had low blood sugar. We were checking the glucose, and the chihuahua got into my bag and got a few of the little finger prickers. About 3 minutes later, under the bed, I hear, yip. Bit into it, and it got bit. So it happens. But get the pets out of the way. Oftentimes, these pets, they're very protective of their owners, right? You know, they're going to be fine. You go over there to touch them to take a blood pressure. Whoa, wait a minute. It's a different game here. So get the pets aside. If there's somebody extra there, send them to the road that they can go. And these are things you may not have to be there, but if you have these conversations with your clients, they're going to have an idea of what to happen. In this country, we did a fantastic job of teaching everybody to call 911. We've done a horrible job of telling them what to do after they call 911 or what to call 911 for. They have no idea. Be that mouthpiece to educate these folks. We may have to move furniture, medicine bottles. I can't preach this one enough. I'm sure Ryan will agree with me on this one. You go in from the EMS standpoint and you've got a pill minder. I use one myself for some of my medications. It makes it easy to keep up with if you've took it, if you haven't. EMS arrives and they're in a hurry to get this person loaded, and they look at, and I really wish I'd have grabbed a picture a few weeks ago. I ran a call that was the largest pill minder I've ever seen. It had to come off Amazon because it is this big. It's huge. Round, circle, all different times in there. Huge. But you look at that and you need to know these meds that this person's taking, and you're just seeing a pile of colored gravel that's been slung out there trying to identify what this is, and sometimes that's difficult to do. The other thing the bottle is going to do, how many have done a medicine reconciliation for a client? Y'all know how difficult that is. And then they're going to take that list and they're going to put it in their purse or in their pocket or in a notebook, and they've been to the doctor and something's changed. If we've got that bottle, we've got a date of when that was filled. Sometimes you're going to get clients that call and they say, yeah, I'm taking this. And you look at it and it was filled 9 months ago with instructions once per day with a quantity of 30. You know they haven't been taking that regularly, but if it's in their pill binder, they may have been saying, yeah, I don't want to take that, and skip that one every day, but it's in that pill binder. Get the bottles. It's going to be another clue to what's going on. The other thing the pill bottles will do is when these patients get to the hospital, it's going to have doctor information that wrote that prescription. If they don't have all of the information, that may be another piece that they can tie in to find out where this person's been. We'll have questions coming up towards the end of this. Face sheet. Any of you guys using software to keep up with your clients? You're able, most of them, to print a face sheet. When you meet with your clients, give them a copy of that to put in their information to give to EMS when they get there. That's going to communicate a whole lot to these folks, and not even just at EMS, but at the hospital level. It's going to go with that EMS crew to the hospital. We need to find out who all the client wants us to notify. Do we need to meet them at the hospital? That needs to be pre-mapped out. If you get that call at 2 o'clock in the morning, they're going to the hospital, you want to have that decision made if you as an advocate are supposed to go. Okay? You're billing by the hour. They may not be able to make that decision, but if they've told you in advance, I want you there, you know you can get up, you're going charging by the hour to go to the ER with them, okay? Things we can sell to improve their quality. What do we want to avoid as an advocate? And family members for that purpose, same thing. Don't drive the person to the hospital. If they're bad enough that they needed an ambulance, and I know, Ryan, you're going to tell me there's stories out there, people that call for an ambulance and stub toe that needed to go by car anyway. But if they're bad enough that they've called for an ambulance, let the ambulance go ahead and come on there and treat them. Okay, and I'm not talking our stub toes that we rerun occasionally on that, but if they're truly having a serious medical event, if not, you just need to be loading them up and going in a car. And by say you need to, not you guys as advocates, but the family, of course. We don't want to provide any medication unless they're instructed to do so. Of course, we're not going to be providing that medicine as an advocate, but we want to make sure that the family knows that. Follow the instructions of the 911 dispatchers that are going to give them some guidance on that. Don't move anybody if they've got a suspected head or neck injury. You know, we kind of get that beat into us with EMS, but let them know if it's a fall, we want to leave them kind of where they're at if they're safe there and still able to breathe and things are okay for the moment. Don't leave that person alone. Y'all ever heard the story of somebody gets choking in a restaurant, they cough, they go into the bathroom, and somebody goes in there and finds them dead because somebody went to the bathroom by themselves? It happens. Don't leave that person alone. Whether that's you, family member, somebody, when you call for an ambulance, somebody stay with that patient. And don't panic. As the advocate, you're going to have to stay calm in this situation. They may call you on the phone, hysterical about things. You've got to stay calm with this. So what happens when EMS arrives? Questions, more questions. And this is where it gets really tricky. You've probably answered, or the family has answered all these questions when they called 911. You're going to have to answer them again. Everybody remember playing telephone when you were elementary school? One person to the next person to the next person to the next person. Yeah, next thing you know, this person swallowed a goldfish, and that's why they got called for 911. They're going to ask questions. The EMS is going to be asking these questions to find out what state this patient's in. Mentally, physically, finding out, doing an assessment, seeing what's going on. With that, it's very important that you paint a very clear and accurate picture to what's going on there. Because the tone is going to be set from this point moving forward with the care of this patient. EMS gets there, the family's not really concerned, nobody's really taking it serious. I'm not going to say that EMS is not going to take it serious, but it's going to change the tone of that call. Things that happen leading up to this, they're going to ask questions. You've got to be honest and serious about what's happened and what's going on. A lot of times in EMS, we'll get called out and it'll be, Mama's just not acting right. Well, as an EMT, I need to know what not acting right is. Explain that out a little further. This is not normal. This is what's going on. Sometimes we got to push for that. And it happens in the pre-hospital setting as well. We all know about it in the hospital setting. It does happen in the pre-hospital setting as well. Order of things that's going to happen when the EMS crews start getting there. Let your clients know that the first units that arrive may not be a transport unit. I see this happen with families all the time. They're all upset about it. Well, they showed up and they're not taking them out of the house. They're not going anywhere. Well, they may have showed up in a fire truck. They're not going to put them in a fire engine and take them to the hospital. They're going to wait on that ambulance. But that first crew that gets there, and in my scenario, it may be a volunteer fire department. I may have got out of bed, jumped in my own vehicle, and come to your house. So it happens. Happens every day in this country. They're going to get there. They're going to take vitals, potentially an EKG, maybe give them some meds depending on what level they are. Things are going to start to progress. Also know that they may remain on scene, sometimes up to 30 minutes or longer, depending on the scenario of what's going on. I hear this a lot from families. Well, they got here and they're not doing anything and they're not taking them anywhere. Well, sometimes it takes a while to get those things established, okay? Whether that's starting an IV, if it's cardiac arrest, they're typically going to work that for a while before they put them in the ambulance. Things like that happen. Just kind of let these families know, if this happens, here's who's going to show up. If you understand their local protocol and local area, you can explain that a little better. And remember, it's your client's emergency. It's not EMS's emergency. It's just another call for them. Just to put it bluntly, it's the next call, not their emergency. Send in with our client. Mention the face sheet, medications in the bottles. Who can manage to survive without their phone? Yeah, that's nobody. Make sure they have pre-planned for that, especially if it's somebody you think's really a high potential of having to go to the hospital. Let's make sure that they have got all of their chargers, cords, and I'm not talking short ones, long ones where they can reach from the bed to wherever in the hospital. Everything that they need to be able to function. I mean, if they would need to reach out to their advocates, you want their phone charged, right? So yeah, we need them to be able to call us if they need it. So let's pre-plan their electronics. Emergency contact information. Who should we call? Who do we call? Is it going to be they call the advocate and want you to call everybody else? That's something we can offer to families, right? We can call the rest of them. I can tell you, if it's my family, I'm not going to want to have to call everybody else in the family. I'm busy worrying about my loved one. That's something an advocate can take over and take on for these clients. How many's had trouble getting a HIPAA release to a hospital and getting them to talk to you? Happens all the time, doesn't it? With that face sheet, have a copy of that signed HIPAA release. They're ready to go with them in their packet that they take. If they're alert and oriented, they can hand that to the nurse when they get to the ER and say, here's my patient advocate and here's a HIPAA release, and you can talk to them. We don't have to worry about tracing anything down. And most of all, your contact info. Make sure your company name, your information, your contact info is on there where they can get to you. This patient may have been responsive, alert, talking to them fine. By the time they get to the hospital, it may be a totally different scenario. After they leave, things that we can do. I jumped ahead a while back. Think of security for their home, their car, family, and pets. Typically, fire and EMS will, if the patient's able, if they ask them, say, hey, will you lock the door on the way out? Typically, we'll do that. But we may be in a hurry and not able to handle that. That may be something you can offer as an advocate. And be prepared, because things change. Another thing is to let you know that going by ambulance does not necessarily equate to being seen faster. Used to be 25, 30 years ago, that was generally the case. It's not the case anymore. We've overloaded the system. They're overworked. They're understaffed. There's not enough ambulances. The small community that I live in 20 years ago, where I live at, typically an ambulance would beat the fire department, if not getting there about the same time. We're now seeing times that we're setting on scene with a fire department with a patient for 50, 55 minutes before an ambulance gets there, because they're having to pull from out of county. When they get to the hospital, they may be sent to a holding wall. Anybody ever heard that term? Yeah, they may be sent to a holding wall. They may be triaged. They may go to a waiting room. They may look at them and say, yeah, okay, you're fine. Get off that stretcher and go sit in the waiting room. It happens. Keep in mind, space at the ER is going to be limited. Find out if they want you there as an advocate, and make sure all the rest of the family knows, where the 15 cousins, uncles, brothers, and everybody else that shows up is not mad about it, that you're the person they want there. Have that information and have that plan in place. Another thing you can do when you're at the hospital is get to know the surroundings. Find out where the vending machines are at, where the restrooms are at, how the communication system works there, how you're going to talk to the healthcare team, who do you need to talk to. Find out all of that information so you can help the family. If there's room for another family member in there, they can focus on their loved one and you can handle business.